when you're hypermobile, you're not flexible, you're unstable.
Connective tissue disorders and hypermobility are really common issues in the mast cell and histamine community, and a lot of people don't even know that this is an issue for them. In this video, I interview an expert on hypermobility, so if you have mystery pain or if you suspect this is an issue for you or you have a diagnosed connective tissue disorder or EDS, stay tuned to learn more. Thank you so much for being here with us today. Could you just briefly introduce yourself and tell us a little bit about your background and how you got interested in this subject of connective tissue disorders and histamine?
Absolutely. First of all, thank you so much for having me here and allowing me to get my message across both the patient side and the provider side that may be listening to this podcast. I'm Dr. Shakib. I am a licensed chiropractor that does not practice chiropractic necessarily. So I started as a chiropractor and I've been in practice for over 30 years. So probably almost as long as you've been on this planet. But the reality of it is that I've always been heavily into chasing the whys behind the presentations that patients have had. And I found the answer in paying attention to the movement patterns, the profile of functionality of individuals when it came to musculoskeletal conditions. And so I started doing what is referred to as developmental kinesiology. So we all start from infants becoming toddlers. So we're all helpless infants becoming running toddlers, no gyms, no bands, no weights, no trainers, no chiros, no PTs, nothing. And how do we do that? So it's reasonable to say that we are programmed to innately follow these patterns of movements. And there is an absolute intelligence behind those patterns of movements and the neurology that goes with it. So that made total sense. And I started implementing developmental kinesiology, specifically the teachings of dynamic neuromuscular stabilization, or DNS. So as a result of doing that, the success rate went very high, and I started getting people from all over coming to me, mostly failed cases. What I noticed was the fact that pelvic floor dysfunction was a common denominator. And it made sense if we have instability and our pelvis is the base and the foundation of the structure, our trunk. And I always jokingly say, without our arms and legs, we stay alive. Without our trunk, we no longer exist. So the foundation had to be strong. And if we have dysfunctional movement patterns, then the foundation is definitely compromised. And that, by definition, my definition, is pelvic floor dysfunction. So I started getting trained in the realm of pelvic floor. And there were beautiful things that were being taught. And then there were some foundational pieces that I disagreed with. So I started doing things again my way and started focusing on stabilizing the house, the pelvis, that pelvic floor is the floor of. And I started seeing patients that were not being necessarily getting the proper result that they were after from other pelvic floor offices. The one thing that was common was not every hypermobile or every person with pelvic floor dysfunction was hypermobile, but every person with hypermobility had pelvic floor dysfunction, which of course made total sense. If I have joint hypermobility, it's in every joint. That includes the joints within the pelvis and whatever is connected to the pelvis, which is the spine and the lower extremities. So because of the fact that I do developmental movement exercises, it's so gentle and so, so gentle and really not aggressive in do this many sets of or this many reps of this exercise, strengthening and stretching. because once again, we don't strengthen, we don't stretch, and yet as babies, we're very flexible and we're very strong by the time we turn into 2. So strength definition started changing for me. And for my hypermobile patients, my methodology fit the bill just perfectly. What I started noticing was, oh, my bendy patients don't respond the same way to the same cueing. And they were maybe not strong in specific, let's say, proprioception, which made total sense because they don't have that tensile contraction of the ligaments. But then I could use other methods that they would shine. And so it became more and more obvious to me that hypermobility was no longer a rare condition. And there were other things that were existing. So it wasn't necessarily, or there was a correlation between different things and hypermobility as I started seeing more and more and more hypermobile individuals. These people, the hypermobile population, had a high incidence of neurodivergence, at least in my practice, and mast cell activation. So then I started looking more and more into mast cell. Why is it that this is happening? There are a lot of things that we are seeing that we don't necessarily know the solid fact behind why this is happening. So we're in the infancy stage of understanding things, but we can't deny the fact that hypermobility exists. It's a lot more than we were told in school. And it really, really upsets me when I see that just because the provider does not recognize what's happening, the provider does not connect the dots. The provider starts gaslighting the patient. I hate to use that word because I think it is overused as well by both general public and the hypermobile community, but I do know that it does exist. So, one of our core values in the practice is be the agent of hope, not false hope, but right hope. And I just found my community. I found the group that I believe I became a provider to serve because my most educated patients are my hypermobile MCAS patients. Man, they know so much more. It's almost like talking to a colleague. And then I look at what I do with them, like jokingly say this is like an SAT course. You don't gain intelligence, you just learn how to score high on the test. So it's a matter of understanding how to be and what the wrong tendencies are and how to replace those wrong tendencies with the right answers to better understand. So in order to get there, we all have to become so much more educated about the body. And that's really the essence of what's happening in my practice. And I don't know if I answered your question. I think that was such a long way to go to it. I'm not hypermobile, but I might as well be. I mean, I live and breathe in every minute of my waking hour, even according to my husband's sleeping hours, I talk about hypermobility. So, and MCAS, that's another one of those things that we don't really know the percentage of hypermobile population with MCAS, but from my practice, it just seems like it's definitely in the high 90s.
Okay, so hypermobility patients who have MCAS.
Yes, it seems like over 90% of my patients with hypermobility also have MCAS.
Okay. Yeah,
So
I've heard that there's a really high correlation. I'm curious if, in your opinion, do you think that there's maybe a lot of MCAS patients who have hypermobility who aren't aware?
I'm just surprised when so many times a week I end up diagnosing individuals with hypermobility, I have my theory on that. It just seems like majority are female.
Mhm.
And I don't know what happens. We start questioning the validity of what we are experiencing. So from my practice, it definitely seems like high majority of my hypermobile patients have MCAS, but then there are so many other correlations. Like, for example, I already mentioned neurodivergence.
Mhm.
There is like dysautonomia is one of those things that happens. And the autoimmunity, there is a high number of people with hypermobility that have autoimmunity as well, or chronic fatigue. So there is definitely I think we really don't know enough yet. It's just pure observation. Just because this exists does not mean it causes
Right.
the other condition. But of course, it doesn't help to be hypermobile and go through all the non-joint related symptomology and issues that the person experiences. And then on top of that, deal with MCAS,
Mhm.
you know. But definitely there is a skin issue. And I think most people may think that hypermobility and Ehlers-Danlos syndrome or EDS are the same.
Mhm.
They are both connective tissue conditions, but they're not necessarily the same. And then even with EDS, we have 13 subtypes that we know, and not all of them have genetic association. It's just, it kind of gets blurry as you go up the pyramid. And bottom line here is uh, for us to start questioning ourselves and what we are experiencing is always the wrong answer. And that is the part that I think breaks my heart the most. And I always tell my adult children, when you become the voice for the underdog, it's a lot more valuable than when you are part of that group. So I think as a non-hypermobile, when I speak up for my hypermobile patients and population, I have so much compassion and so much determination to let the rest of the people who are ignorant to what's happening to just take that blindfold off and start
Mhm.
paying attention. Those people who are listening right now, I'm so sorry that you have experienced so much disbelief, and that should not have happened. And I hope I'll be a part of the solution than the problem.
Yeah, I love that. I think you touched on a lot of really good points, and you've mentioned the gaslighting, and I think that's so common in this community of autoimmunity and mast cell issues. We have so many different systemic symptoms. So yeah, we do go through a lot of trouble with our doctors trying to figure out what's going on exactly. So what kind of symptoms would you be looking for if we had a connective tissue disorder as well? What would we go to our doctor with to get a diagnosis?
So, in general, with hypermobility, we're talking about joint hypermobility. People come with aches and pains all over, and they're looking at, oh, I have back pain, I have sacroiliac pain, hip pain, whatever the case may be. But as a provider, when I'm listening, and that's the key, and that not enough of that is happening from this end. When I'm listening, it is important for me to understand the activity of the individual. The moment they tell me, and it's not right this minute, what have you done in your life activity-wise? When the individual is in dance, in cheers, in gymnastics or acrobatics, I'm immediately wanting to rule out hypermobility. So because I see so many people with hypermobility, just the demeanor, the way they cross their legs, and then they do, you cross your leg, but then there's a cross your leg, and then there's another cross or wannabe cross. That is not a regular, this is not a normie move. If you're moving your hands, you're talking, I mean, we're not talking about Italians talking, we're talking about this movement that happens, a lot of that happening. That to me immediately signifies, oh, there's a chance of hypermobility here. These are the subtle things that we're referring to. But in general, when you have multiple joint issues and they're continuous and you can't figure out, you wake up in the morning and all of a sudden your hip is hurting. And what's so funny is like when I'm talking, they say, well, you know how you get out of bed and your hip's hurting? I'm like, no, but I hear you. Yeah. And so it's very easy to get subluxated. Subluxation is that stage right before dislocation, if you may. If it was a car driving and stopping at a crosswalk, you should stop right at the crosswalk, but then you can go into the crosswalk a little bit, or go on the other side of the crosswalk, at which point you're definitely in the dislocation phase. So being in that crosswalk is different degrees of subluxation, so to speak. I try to explain things in those fashions. So joint hypermobility, those are the joint related things. There is a history of stomach issues. So we're talking about they typically say it's IBS. I also have IBS. I also have gastric reflux, the GERD. Or they say that, for example, their ankles hurt in the morning. Ankles are pretty darn common joints. And then, of course, they're bendy. They are double jointed. Their skin, there are certain types of EDS that the skin stretches, so I can lift this up and it goes a lot more. There are some types of EDS where the individual looks a lot younger than their age. Their skin is like perfect. They bruise easily. They can get swelling in their hands and feet for no reason. Very intolerant to heat, but then they're also very cold in the hands and feet. This is a connective tissue disorder, and your blood vessels are connective tissue. There are a lot of tachycardia, increase heart rate, or POTS. When they get up, they kind of feel dizzy and they need to sit down. We undermine these things, and I think as women, even though we may come from very strong, balanced households, I think even in today's society, in this country even, I think we're looked at as weak. If, oh, well, you're just a weak person. You get up and of course, you're just so skinny and so weak and you need to eat more. I mean, it's like, no, this is all different parts of hypermobility, EDS or not. This is a connective tissue disorder. So there are different variations, different names for different conditions, all of which have joint hypermobility. So I do have patients with other types of hypermobility or connective tissue disorder that do have hypermobility, and I'm seeing. So those are the things that the people may have, but they never connected the dots. It's just now all of a sudden they're thinking, wow, I'm getting older. Though here's the other thing. As children, maybe before teens, we may shine because of the abilities to perform activities that other people couldn't do. And so we're encouraged to keep doing it. And that's where the damage happens. And then something happens during the teens. From my collection of data, I can tell you that even early 20s is when the decline starts happening, because it's like, wow, everyone else is going out partying, but I'm fatigued. I'm hurting. I can't, and then there is this whole, by the way, anxiety is part of the symptomology too.
Hmm.
And then we're like, I'm so unreliable. I can't even do this. So then we start having those negative adjectives. That inner conversation starts changing. So it's almost like not almost, it is a feedback loop of many, many things that don't necessarily push us in the right direction. And then family members may think, well, what's wrong with you? You're so young. You shouldn't be doing this. I mean, oh, what? What's no, now what? There are things, CSF leak, cerebrospinal fluid leak with headaches. That's fairly common. It's not in everyone.
Hmm.
So having headaches is very common. But then again, with MCAS, you can have a lot of those too.
Yeah.
So, with MCAS, we're talking about mast cell activation. So mast cell produces a lot of different things, including histamine, including cytokines, including interleukins. These are all inflammatory chemicals. So you're increasing your inflammation level. And then I really think from the studies I've done, autoimmunity is not something that you acquire. It's something that probably we all carry. It's just something awakens the beast.
Hmm.
So when there's an ongoing, that's my theory, by the way, when there's an ongoing stress on the body and you're constantly inflaming it, that is an insult. That is a trauma to the body. And then the autoimmunity becomes obvious. Autoimmunity in the life of my practice was not a word that was being used. And like Hashimoto's, where everyone knows about it pretty much, it was and still is treated as if it's hypothyroidism, when in reality, it's not hypo because sometimes it's hyper. So treating it as hypo does not make it the right answer when it is hyper. So connecting the dots is important, even though we're not talking about the same system that is being addressed. We have in today's healthcare chopped human beings into pieces, given each piece to a specialist, and for some reason, we're just looking at it this way. We're not looking at individuals holistically to see the overall picture. So in a way, the carrier, the guide, the guardian of the body, which is ourselves, becomes the person that now needs to look for the answer. Whereas we've been brainwashed into thinking there is this authority figure, this organization, this entity that knows everything. And so if they don't say this is happening, it must be in your head, or, oh, wow, I'm helpless. So that's the wrong neighborhood of thinking that we get into, you know?
Yeah, so yeah, there's a lot of overlapping symptoms that you get with a mast cell condition anyways. So if a person suspects that they might have this, what would be next steps for them to get treatment?
So in my practice, when I suspect joint hypermobility, and again, in the history taking, I can see that there's a chance of MCAS. So I do have referrals for looking further into MCAS. But if it's joint hypermobility, the next step is from the treatment aspect, it makes zero difference if the individual has Ehlers-Danlos or Marfan's or Sjogren or HSD, hypermobility spectrum disorder. We always start with breathing, always. And I jokingly say, you may think, okay, I got that one down, and my answer is think again, because you don't. So I think that if we lower our ego to basically get rid of our ego and start looking at things from the very basic level, and that's just what I have done. I don't know if that's the right answer for everyone. I'd like to think it is, but I don't. It's not about what I think necessarily. And when we are born, the first thing that we do is we breathe. That is not because we went from liquid to gas and we went from the womb to the planet Earth. There's so much intelligence behind that. That's like our computers having so many softwares. We can't utilize them without plugging them in. Breath is that plug in of the machine that we are. And with it comes so many amazing things that happen with every breath. I mean, every time you breathe in, the muscles inside your pelvis relaxes, for example. Every time you breathe out, the muscles inside your pelvis will contract. The stability of your pelvis is so foundational to the movement that every breath assures it is strong. And yet we don't do anything about our breathing. We talk about belly breathing, power breathing, this breathing. Why don't we get down to the biological breathing, the good old breathing? So I always start with breathing, and then I go through with my MCAS, hypermobile EDS patients. I go through the first steps of movement, tummy time, side to side, things like that, with coordination of breath with those movements. And then I very quickly want to find out what the wrong tendencies are, because we're still living. So we can't pause life because we're going through these stages of development, or at least implementing those concepts. So it's very important to understand, how do I get out of bed? How do I open a door? How do I sit in my car? How do I vacuum? How do I put clothes in the washer dryer? Things like that, the ADL activities of daily living. We practice those, and then we continue with a few more things. And then it's all about, once again, finding out each individual's tendencies, wrong tendencies, and replace them with the right answer. It really makes my day when my patients report to me as we're doing exercises, I'm doing this thing, which is the wrong thing, but the best part is I know how to replace it. It's like, yeah, it's always about that. That is life. So in my practice, that is what I do. I know that not every low back pain or every joint pain that people are experiencing and has the same cause, but when it comes to hypermobility, what we do with the normies pretty much never apply to the bendies. We can actually hurt our hypermobile patients doing the very things that we can do with normies. In my practice, it makes no difference, because with my normies, I do what I do with my bendies. I figure if it works with the bendies, it's definitely going to work with the normies. So it starts that way. It's got to have the logical sense. And as a provider, I consider myself a good provider when I don't keep seeing the patient over and over for different joints and issues. Because if they become my apprentice looking at their issue as a project, then they see what I see, they predict what I predict, and they prevent what I prevent. It's all about that. It's all about taking responsibility in how we trade our time. And that's the thing that I think is important for everyone to see. Be very picky as patients. Is this provider good enough for your time? Because your time is that one entity that you will never have a second chance to gain. So treatment in my practice is more than joint treatment. A lot of it has to be coaching. It has to be coaching. It has to be mental health. And so I'm not licensed as a mental health provider, But I can tell you that the best examples of what people do, what works for them, and we learn so much from each other. It's not about complaining, it's about empowering. And I think that's so important. So when you say, what does that treatment look like? I can only tell you what it looks like in my practice.
Right.
And I think that just as we can't, just focus on the shoulder or the back or whatever the body part it is that we have issues with, we also can't separate our mental health from the structural health, from the organ health. It all comes in together. And that's who we all are.
So that sounds like you have a very holistic approach. And it's almost like you have to retrain yourself to use your body correctly so you're not injuring yourself when you're hypermobile.
I think that that's the answer for everyone, Sarah. It really is for everyone. I always look at movement, and not every movement is the same. So as bendies, well, let's just say if I'm moving my house, there's some of my belongings I just throw in a box and I just tape it. And then there is some stuff I own that I need to bubble wrap. That does not make the bubble wrapped items like, oh, you're such a, wuss. It really is not. It's we all need to bubble wrap ourselves. Bubble wrapping does not mean putting ourselves in a bubble. That means we're effectively carrying ourselves from point A to B, not taking the chance to break anything. So I'm not talking about breaking a bone, but when we injure ourselves, that injury will stay with us. It will impact the rest of us no matter what. Julie, about this is 2024, exactly 10 years ago, I fell off my horse and I shattered my pelvis on the left side. I had two choices. One was to just live my life, this is it. Or it's like, I'm going to be that one person that I'm going to do everything I can to not allow this to be my limitation. So I bubble wrapped myself going from where I fell to the hospital. I did not call the ambulance. I'm not saying that's what people need to be doing, but I did. I knew how to be. I was so connected with my own brain that my brain was guiding me so well. I mean, I had over 14 broken pieces, and then I broke the left half of my pelvis into two, and I also broke my lumbar. I mean, it was a nice fall. But when you understand how to be and how to bubble wrap yourself, you actually will recover beautifully. So when it comes to movement, we all need to bubble wrap. And I think the motivation is a lot more when we have joint hypermobility, EDS or not. It's joint hypermobility exists in all connective tissue disorders.
Mm-hmm.
So when it comes to being safe, we all have to be safe. We all have to understand our wrong tendencies and then know how to replace it. What is the right answer, right? Jokingly, I say to my hypermobile patients, don't feel extra special because this should happen to all of us, not just you,
Yeah. Well, I think that you made a really good point. I think for you talking about your experience with your accident and how you really got into your mind and your body connection. And I think that a lot of us who deal with chronic illness and we just kind of become separate from our body sometimes. Like we don't make that connection anymore. And we just kind of start to distance ourselves from our body. So like it sounds like we really need to bring that connection back.
My gosh, I don't want to make this all about my own experiences, but we always use our own experiences to relate to what's happening. It is all about connecting to ourselves, even with pain. It's much easier when we don't have pain to judge pain or to translate what pain is. But even the pain that we experience delivers a message. It has a presence. And I think that when instead of running away from pain, if we look at it as a messenger, it changes the relationship very differently. And I think a lot of times we learn how to be when we're at the point of pain. I remember when I was 15, I learned about the power of mind over body. And I was like, I gave myself stomach pain. I was like, oh my God, my stomach hurts so bad, it hurts so bad. Oh my gosh. I ended up with really bad stomach pain. Started panicking because it's like, how am I going to get rid of this? I mean, oh my gosh, what am I going to do? And I'm like, calm down, calm down. You give it to yourself, you can make it go away. That was my first experience with pain. And then when it came to giving birth to my daughter, I used the same experience and the power of visualization. I remembered the worst, if you've given birth without any medication, you know what I'm talking about. It's like, oh my God, I think I'm dying. And these people just have no clue. They've never encountered this condition that I'm having. That was honestly my thought at the time. And then I remember thinking, well, when the pain was at its height, I would associate it with the most beautiful scenery vividly imagined in my head. So it was kind of a mixed feeling because as I was looking forward to living through that scenery, but that meant I was looking forward to having the pain, which doesn't make any sense. But that's how I went through the whole experience of childbirth, and everyone else was thinking I was sleeping. Well, that's what hypnobirth
Mm-hmm.
is. So if we can do that in that scenario, what is stopping us from other scenarios? When you do that, I feel like we actually build a stronger relationship with ourselves, and we're no longer afraid of pain. We have a relationship with it. It's much easier for me sitting out there with no pain to make this statement. I understand that, but I also think that I have a little bit experienced it
Mm-hmm.
with my own pelvis and childbirth and everything else. So I think that just as we criticize the medical community or the health approach in the country from dividing us into pieces, I think that we should not do that ourselves when it comes to our own health. So to disconnect with our own body because we don't want to experience pain, I don't think that's sustainable. I think that the outcome may actually not be as desirable as we want. That's just my personal opinion. Doesn't make it right. I think people who are listening should definitely judge their own situation and make the decision that they feel more comfortable with. But that's just my opinion on this
Mm-hmm.
subject.
So you're in California, right?
Yes.
So if somebody in California wants to see you, that's great. But what about the rest of us? Where should we go if we suspect we have a hypermobility or a connective tissue disorder, or say we've given birth and we need some pelvic floor therapy? What would you recommend in looking for a provider? Like, what questions should we ask?
No, you should always, always, always look for a provider who treats your condition. Just because we hold the same license does not make us equally the right provider for you.
Mm.
If we treat patients, not heard of it. I heard about EDS for maybe 5 minutes when I was doing my grad school. Yeah, and I was told it's rare. Well, that's not my experience. So
Mm-hmm.
you want to see someone that treats someone with your condition. So if you have pelvic floor dysfunction, which if you're hypermobile, you do,
Mm-hmm.
you should look for someone who does, who knows or treats hypermobile individuals with pelvic floor dysfunction.
Okay.
Not every PT, not every DC is the same. So what to look for is, number one, are they treating hypermobility and fill in the blank? Number two is, can you actually talk to this provider? Like, I always treat my patient, I look at my world, I guess, based on how would I like it if I was on the other side.
Mm-hmm.
When I think about any business I give my business to, I want them to drop everything they're doing because I walked in. That's how I like it. That does not make me a princess. If that's what you want to call it, I can live with that too. That's perfectly fine. But I want you to be giving me your 100% undivided attention. I want you to teach me how to be, because I don't want to keep coming here.
Mm-hmm.
And I want to know, what is it that I need to know to make this thing go away? And if it can't go away, what do I need to know about this? So that means the individual needs to be not treating you as, I know more than you do, just get your butt over here, let me do my thing, stop asking me any questions because I don't have time and I'm running late. It really does not work that way. And, frankly, you pay for the price. You pay the price of that visit, but look at the value you're getting. The value is not the treatment of that body part. The value is the education that you get, so you don't need to go as much, or hopefully ever. It depends. In my practice, I have a 15-20 minute session at no charge. I personally, I 100%, as a woman, I 100% value my gut feeling. I do. I think that was given to me as a gift. As a woman, we have that gift. I want to know, what is my gut feeling about this person who is going to know the intimate things about me? And if my gut feelings like grab your person, run away, I will do that. So invest in that. Really, I think when we look at things with desperation, our decisions are not always the right decisions.
Mm-hmm.
When you look at it from a different perspective, then you'll do much better. So what to look for is someone with experience, someone who is okay to even call you, maybe 5 minutes. That shows so much. That means this person does care, in my opinion.
Mm-hmm.
And then you trust your gut feeling. Do a little research beyond what okay, this person seems to be okay. Start doing research and go across the board. I personally hate Yelp for different reasons. But do your research. Start looking them on social media. Does this align with what you're looking for? We have so many easy ways to really get into understanding each other now. And just go forward, always ask questions, always chase the whys. And if the provider gets all upset over how many questions you ask, it's okay, fire them,
Mm-hmm.
move on. That's that's what I do when it comes to any business I interact with. And that's what I think people should be doing. I think I might have written a blog on how to, or maybe did videos. I mean, whatever comes to my mind, I have like a piece of paper on my desk right outside in the big room, and I just write the idea. If I repeat something a couple of times, that's worth writing a blog or doing a video on. I think that we have so much access. We're so fortunate to have access to so much social media. You can do a little bit of detective work.
Yes.
And it's crazy what people can find. That's my advice. It's not a rocket science, honestly. It really is not. Trust your gut feeling, even though they've said, oh, you're so this and that. Don't listen. Do what is right for you. That's my non-scientific advice, but believe me, it comes from a lot of experience.
Mm-hmm. I know you had mentioned that you do a lot with pelvic floor, and then we talked a little bit about pregnancy and pelvic floor therapy. Is there, if somebody knows they have a connective tissue disorder, if they have like EDS, is there anything that you would feel that they need to know about becoming pregnant or carrying that pregnancy or post-pregnancy?
That's such a beautiful question that you ask, and thank you for asking that. I think as a lot of times people do wish to become a parent, and I understand that. I think when it comes to connective tissue disorder, there is a logical answer, and then there is a emotional icing on the logic.
Mm.
So we need to, I always look at pregnancy as a marathon. So you can't do well in a marathon and expect to do decently if you don't train yourself. So to me, there's a lot of work that should be done before pregnancy, but then not everyone plans on it that way. But in general, I think it's important to know how to use what you have. So with hypermobility, we don't have the ligamentous stability. So when that happens, we need to understand how to bring the muscles that work in groups and how to stabilize ourselves to not fail. I am a big fan of using supportive braces for my hypermobiles. That's the only group that I'm okay with. So when it comes to pregnancy, the SI joint, we produce a hormone called relaxin that opens up the joint because we need to accommodate the growing baby. So if you're hypermobile and now you have relaxin, which by the way, you don't have to be pregnant to have that. Now things can and then your tummy's going forward. Now things are going against you. So those supportive braces are good tools to use. When it comes to individuals postpartum, again, it goes back to understanding the stability of the areas that you experience the most discomfort or subluxation potentially. And then again, this is not something that is just for the bendy. It is for everyone, but the bendy the tolerance is a lot less. Okay. So using sacral belts are important for the bendy. It is so important to not, please do not, whoever is listening and watching this, please do not use flip-flops. You've got to wear shoes. I know they're not necessarily the cutest things, but you need to have a little bit of coverage around the ankle joint. When it comes to stability specifically, since I mentioned breathing becomes your best friend. So breathing biologically, and that's a term that I have created for the baby breathing. So breathing biologically is not the belly breathing, that's breathing in through your nose, breathing out through your nose. But if you place your hands right at let me come up so you guys can see right here and here. If you place your hands and the thumb is in the back part of my body. If I breathe in through my nose without pushing onto my vagina or penis or anus, without going that far, because that you're not bearing down, can you breathe in and push your sides out? That is biological breathing. This is what babies do. So I've done videos if people want to look that up, and you can YouTube that. But there are different tools that I think are necessary for everyone to use. Breathing is one of them, and understanding your wrong tendencies and learning how to be, if you can plan on having your pregnancy or getting pregnant and work on this beforehand, that would be lovely. Not taking things that you may be sensitive to, like in case of MCAS, histamine is is an issue. So we want to have the low histamine foods. That would be a good thing, like kale, onions, things like that. So there's a low histamine diets that would be something to consider. Planning is always a good thing. Surprises
Right.
kind of ruin the plan. So that's the advice that I have. I do have some young individuals that they ask me, well, do you think I should get pregnant? I'm like, "Oh, that's such a hard answer because I can't tell you that.
Mm-hmm.
I really can't tell you that. It is not my place. Is it logical? I'm gonna have to say no. It's not logical, but the world is not always logic either. So you got to evaluate, put the two on two sides of a scale and see how it is. There are ways that the more you know about your body and the more you know how to replace the wrong tendencies, the better off you are. There are plenty of people who are not hypermobile and they don't have a successful pregnancy as far as their joints are concerned.
Mm-hmm.
So what's the difference there? I mean, are we going to apply that rule across the board? There goes the world population, I guess.
Right.
So just keep that in mind is what I recommend.
Okay, great. So I have another question about more about symptoms. You're looking for like double joints or like extra like mobility, right? What about, can you have like a connective tissue disorder like hypermobility but not actually feel flexible?
There is a difference, Sarah, between flexibility and instability.
Mm-hmm.
When you're flexible, it's a very healthy thing. When you're hypermobile, you're not flexible, you're unstable. So
Okay.
there is a score, there is a criteria called Beighton score. The maximum you get on that is 9. And then, you can do things, and I don't advise, like when I'm doing these things, I record on it, like take pictures, and I tell the patient, this should be the last time you're doing it. If people ask you, can you do this, show them the picture because you can't keep doing this, right? So there are certain things you can do and you can score within that. If you're 0, then you're not hypermobile in all of your joints. Maybe you're hypermobile in one joint because you kept spraining that ankle over and over.
Mm-hmm.
That's again, that's instability as well. So to answer your question, I think that flexibility is beautiful. Instability is what we want to avoid. So can you be hypermobile and flexible? I don't know if I'd call it no. The answer is no. You can be flexible and definitely not hypermobile. But if you're hypermobile, you're not flexible. You're unstable.
Mm-hmm.
Does that make sense?
Yeah. Yeah, I think that a lot of people think that if you have hypermobility, then you should be super flexible. So they think, well, I'm not flexible, so I couldn't be hypermobile.
No, you don't have to be um unstable in every joint.
Mm-hmm.
So flexibility, like I can bend down and touch the ground,
Mm-hmm.
but there are a lot of other things on the Beighton score that I can't do. So I am flexible there. And here's the other thing that happens. A lot of times people say, well, I'm stiff. How am I hypermobile? Or they can touch the floor. They can do all these outside the norm mobility in their joints, but they still feel very stiff, like they want to stretch.
Mm-hmm.
Well, the reason for that is because when we move, it's the muscles contracting, and what their abilities are shines through the action of the ligaments. So when the ligaments are loose, the muscles can still contract, but not show what they can do because things are unstable.
Mm.
A lot of times that overcontraction causes tension in the muscles, and a lot of times the muscles overcontract to give a little bit more stability. So that feeling of tension does exist. It's not in your head. But then when they want to stretch, it's like, oh my God, that hurts me just looking at it. Please don't do that. Let's find out what we need to do instead. A lot of times, one of the things, jaw pain is so common because that's another joint, right?
Yeah.
So people crack things in their jaw and their neck. There are plenty of people who do the neck cracking, but they're not hypermobile. So all that cracking that you're doing is actually doing quite a bit of damage. So that should not happen, and it should be replaced with something else. That something else is the exercises. Like one of my favorite exercises is this thing called quadruped, when you're on all four with a neutral spine. So the way the DNS exercises, developmental kinesiology exercises are done, it could resemble yoga, it could resemble Pilates, but I think those are offshoots of DNS, which, by the way, since I mentioned yoga, as a hypermobile individual, I think people should not do yoga. It feels great, but it puts you at that really, really fine zone where you can go to that extreme very easily. And I hope that I'm not creating any haters here because I said that, but there are some yoga moves that are 100% horrible for hypermobiles to do, and they're very good at doing them because, again, it's an extreme, right? And then frankly, like when you do downward dog, and if you have POTS, and if you're hypermobile, when you're hypermobile, it's not just the joints. Your internal organs are connected to your chest cavity and your abdominal cavity with ligaments and connective tissue. So when they are loose and you're looking down, all of your internal organs are going to be pushed down towards your head. There are people who pass out doing downward dog, as an example. So you got to understand more about you. Not about the disease, but more about you, because not every two individual with hypermobility, with MCAS, exhibits the same signs and symptoms. It really doesn't have to be. Do you know you? Chances are you know more about your phone features than your own body features. That needs to stop. Sorry, guys.
No, I love that. I love that answer. I think that that's exactly what we need. We're the experts on our body. Nobody else can tell what we're experiencing. So
Exactly. Understand the why. There is always a why. And the why is not because I got pregnant. The why is because my connective tissue is da 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 da, and pregnancy does X, Y, and Z, as an example. So then you got to apply that concept to a more general presentation that life brings to you.
So is there anything else that you'd like to add before we wrap up? Anything else that I didn't ask you that you feel like people should really know about this?
I think for the individuals who have hypermobility or MCAS, I really, really would like for you to reconsider how you look at yourself and the questions you may ask yourself in the privacy of your own head. And why is it me? And why does it happen? We all have it. You don't have to be bendy to have those thoughts. And there is value in addressing them, but there is no value in dwelling there. So that's what I really want to get across. I'm, as a provider, my goal is to get the message across to all providers, and because not enough is happening. For the providers that may be listening, chances are I don't have to tell you anything because you're already listening. So you're already doing more than what your colleagues may be doing. But it would be much nicer if you start talking about this to everyone else. If we all talk about this to 4 other people every single day, the ignorance will go away. I don't know if it's, you know, how when you're pregnant, you notice everyone seems to be pregnant. So I don't know if this is because I live and breathe hypermobility and pelvic floor dysfunction that this is, I see so much more of it, but there honestly seems to be a lot more awareness. So to answer your question, I just think we all need to talk about other people. To other people about this condition, and to not undermine and not overplay either. There is a balance there. Find out how, look at it like a game. If it's a game and you are to win, what are the rules to win? It's never to be negative. That does not get you to win a game. The game is won when we understand how to be. And I think that's very important. So that's it's not necessarily a question that you had, but a message that I wanted to get across.
Great. Well, thank you so much. You mentioned a couple times, you mentioned your blog, you mentioned your YouTube channel. Can you tell us where we can find you?
100% yes. My website is called hypermobilitytherapy.com. And I, believe it or not, I have 3 different channels for Instagram. Because when I would tell everyone about hypermobility and pelvic floor dysfunction, they would just like, yeah. Well, I put the same darn thing on a channel for pelvic floor dysfunction and on a channel for joint hypermobility, and they're like, oh my gosh, that is so true. So when you say, I'm going to give you my hypermobilitytherapy.com as the website for my hypermobility, and I'm going to give you my functional mobility Instagram and Facebook page, which is at Irvine Spine. I also have one at Core Pelvic Floor and at Joint Hypermobile. So pick one and you'll find your way through the other ones as well, because it is in the bio. I would suggest at Irvine Spine as a good place to start. But the blogs are on hypermobilitytherapy.com.
Okay, great. And I'll put those in the description too.
Thank you, Sarah.
All right,
You're
well, thank
awesome
you.
for doing this.
Thank you so much. I appreciate you taking the time to talk with us today.
Thank you so much. And everyone, I love you.